In an esophageal reconstruction, the first goal of the operation is to identify the top part or the upper esophagus, and then to identify the lower part of the esophagus, and then to see if we can do what's called a primary repair, meaning connect the two ends of the esophagus together. Once we can convince ourselves that we can do that, fine sutures are then placed through both ends, and then once all the sutures are placed, all the ends of the suture are pulled together so that the two ends of the esophagus are approximated or brought exactly close together. Before tying the final sutures down, a tube is then placed through the esophagus to allow the suture line to heal, which can take anywhere from 1 to 2 weeks. In cases of short gap esophageal atresia, the top part of the esophagus ends fairly close to the trachea, and then the lower part of the esophagus actually starts again at the bottom part of the trachea. So there's usually a gap of only maybe a half an inch or so, and those ends can be sewn together quite easily. However, in the case of long gap esophageal atresia, usually the top part of the esophagus ends at about the same place, but the bottom part of the esophagus is very short. It starts way down in the lower chest. So reconstructing that in terms of pulling the two ends together is much more difficult. And then finally, this is a diagram showing a normal esophagus where the tube is continuous and connects the mouth all the way down into the stomach. Patients with esophageal atresia, the prognosis is generally quite good, although a lot of chronic problems can occur. Many children with esophageal atresia, for example, have what's called gastroesophageal reflux, where oftentimes they can reflux whatever they eat back into their chest, causing heartburn and some other symptoms such as poor weight gain. However, many children do quite well and can be managed successfully using antacid type medications in order to have a very high quality of life. There are some other children with esophageal atresia who have some respiratory problems or have to eat their food more carefully, but long term the prognosis in these patients is quite good.